If you've ever spent any time thinking about how we manage health conditions in this country, you'd realize there are some problems. First of all, a lot of the most commonly prescribed medications don't just treat a symptom. They actually inhibit your body's own physiologic processes. Processes that the body has turned on for a reason, often in response to something deeper. Inflammation, stress, nutrient imbalances, poor sleep, blood sugar swings, all sorts of things. And yet, instead of asking why the body is doing what it's doing, we often go straight to just shutting it down, inhibiting this enzyme, suppressing that pathway, blocking that signal. And when you look at the most commonly prescribed medications that treat chronic conditions, and you ask yourself, how do these drugs work? You realize that for the most part, these drugs work by blocking, suppressing, or inhibiting some bodily function. They shut down some part of physiology in the body. And with that comes a fundamental problem. There is no curiosity about how to improve function, only to inhibit it, suppress it, or block its function. So if we look at some of the most commonly prescribed medications in the US, the ones prescribed to millions of people, for high cholesterol, there are statins, which are HMG-CoA reductase inhibitors. They block this enzyme's ability to make cholesterol, and ironically, they also increase the risk of diabetes. For depression, there are SSRIs, or selective serotonin reuptake inhibitors. So they alter the brain's chemistry, but ironically, they also increase the risk of suicide. For pain, there are non-steroidal anti-inflammatory drugs, which are COX-1 and COX-2 inhibitors. So they may reduce pain, but they also disrupt the normal inflammatory repair process. For hypertension, there are beta blockers, angiotensin receptor blockers, calcium channel blockers. Are you seeing a trend yet? For heartburn, there are antacids, which include proton pump inhibitors, H2 blockers, so they reduce stomach acid production, but in doing so, they also impair digestion and nutrient absorption. The 10th most common prescribed drug in the USA is for nerve pain, and it's called gabapentin, which works by inhibiting calcium channel activity in the nerves, effectively dulling the signals rather than fixing the underlying problem. So this is the pharmacological model, right? Stopping, blocking, inhibiting. And unfortunately, despite the best efforts of doctors, chronic disease continues to rise in this country. And to be clear, this isn't necessarily the fault of any healthcare provider as an individual. It's a problem with the system. The system right now is built around brief visits, right? You get maybe 10 or 15 minutes with your provider. And in that time, they're expected to address your immediate concern, assess your safety, make decisions, and then move on. When you only have 15 minutes, it's difficult to sit down and talk about the full picture of the person, right? Your exercise habits, your sleep quality, your stress levels, your diet, your supplements, your medications, and then try to connect the dots and figure out what's really driving the condition that you came in complaining about. So instead, it's easier to just pull out a prescription pad and say, you have hypertension? Okay, let's put you on a beta blocker or an ACE inhibitor or a calcium channel blocker. There's no curiosity about why someone has hypertension. Is it their diet? Is it stress related? Could it be their gut microbiome? These are questions that get skipped, not because they don't matter, but because the system isn't really built to ask them. And that's where a different approach comes in, one that's based on understanding root causes and optimizing how the body functions, not inhibiting it. Take depression, for example. Conventional treatment typically involves changing the brain's chemistry with SSRIs or similar medications. And for some people that helps. But we also need to ask, what else could be contributing to the low mood and anxiety, right? Could it be poor sleep? Could it be blood sugar swings? Could it be chronic inflammation? Could it be neuroinflammation? Inflammation in the brain itself, which is now recognized as a major contributor to many mood disorders. So a functional medicine approach doesn't just treat the symptom, which I know sounds like a platitude, but it asks, why is the symptom there and how to support the body in resolving it. It's personalized care. It's treating the patient, not the condition. It's not seeing a patient who's fatigued and tired and saying, here, take an antidepressant, or playing the natural supplement game and saying, instead of using an antidepressant here, take some St. John's wort. It's asking, why are they fatigued? Do they have anemia? Do they have a sleep disorder? Do they have a thyroid condition? Do they have poor blood sugar management? Do they have an underlying infection like maybe Epstein-Barr or Lyme's disease? And then working on that issue in a way that doesn't suppress or block or inhibit, but in a way that optimizes the physiology to recover, right? So if we take, let's say, musculoskeletal pain as an example, which is the #1 reason why people seek professional health care. The conventional toolbox is non-steroidal anti-inflammatories to block inflammation, cortisone injections or prednisone to suppress the immune activity, gabapentin to dull nerve signals, and eventually maybe surgery to remove the damaged joint or tissue. But none of those approaches that I just mentioned, none of those interventions restore function. They often suppress the signal without actually resolving the dysfunction. A different approach asks, why hasn't the tissue healed? Is there a chronic mechanical overload? Is there systemic inflammation or nutrient deficiency impairing the recovery? And more importantly, what can we do to strengthen the tendons, the muscles, and the bones through targeted rehab to increase capacity and resilience, right? Rather than using an approach that blocks or inhibits function. This is what you see with physical therapy or chiropractors who utilize therapeutic exercise. This kind of rehab doesn't just reduce pain, it builds structural integrity, it restores function. It teaches the body how to move well again and how to have better capacity. Because, ultimately the goal isn't just to quiet the pain signal, the goal is to restore the system. So the signal no longer needs to be there. So many people are tired of chasing symptoms, of cycling through medications, of being told everything looks fine when you know something isn't. Maybe it's time to rethink how we manage chronic conditions. Maybe it's time to shift the goal, right? From suppression to optimization, from blocking biology to actually restoring it, right? Because when you support the body's systems, instead of just silencing them, you give yourself a chance to actually get better. So if you think back about what you're doing in your own life or how a conventional approach is to block and suppress your body's own functions, maybe you can find somebody in your area who actually takes a different approach to find the underlying cause and work on that rather than just trying to suppress and block. So thanks for watching. We'll see you next week.